Health Facts Now. Your health at a click.
2020 marks the 25th anniversary of the Beijing Declaration and Platform for Action. This year was expected to be transcendental for gender equality. Unfortunately, the spread of the pandemic has highlighted structural inequalities, placing several of the advances in gender equality over the past decade at risk. Women have been disproportionately affected by the pandemic. Pre-existing social, political, and economic inequalities have been accentuated due to the COVID-19. The immediate effects of the pandemic on gender inequality are present in multiple spheres, ranging from health and education to unpaid care work and gender-based violence. Social distancing measures, stay-at-home restriction, and other provisions that limit the free movement of people have contributed to the increase in gender-based violence. Although these measures are necessary to prevent the spread of COVID-19, some women are at risk of violence in their own homes. For instance, many women put their lives at risk when they have no alternative but to remain with their abuser, while others have been unable to access support services for survivors of gender-based violence. In addition, crowded homes, substance abuse, limited access to services affect these women in a negative way. Violence against women has increased in several countries across the world. Although it is still early to obtain complete data, some reports already have shown an alarming increase in violence against women around the world of at least 25%. In some countries, reported cases of gender-based violence have doubled. Latin America has been one of the most affected areas. According to the United Nations, 12 women are killed every day in Latin America due to their gender. Furthermore, the region is home to 14 of the 25 countries with the highest rates of femicides in the world, even taking into account that the vast majority of murders are not prosecuted. Argentina is a country where the figures related to the number of femicides as a consequence of confinement are worrying. Almost half of femicides registered since the beginning of the year occurred during quarantine. Gender specialists have expressed concern about the situation, particularly in regard to how complex it is for women to ask for help if they are coexisting with their perpetrators. In emergency contexts, violence against women, particularly domestic violence, increases due to tensions and conflicts at home. An example is the case of Ecuador, where of 65% of women who have experienced gender-based violence, 45% have been direct victims of their partners or ex-partners. Furthermore, the probability of suffering violence when the partner is at home or unemployed increases by 28%. During this quarantine, femicides have increased. More than a dozen cases have already been registered. The violence has been so strong that even in the Galapagos, the first femicide was registered this year. Newspapers such as The Guardian have published reports about how some governments are not taking violence against women seriously. This is harmful because it contributes to an increase in violence against women during the pandemic. An example is the case of Mexico, where it was approved a budget cut of 75% of the funds for the promotion of gender equality in the country. The United States, too, is a country where reports of domestic violence and demands for emergency shelters have heightened during the pandemic. The U.S. is experiencing a marked inequality in the percentage of infected people, hospitalizations, and deaths among minorities such as African American, Hispanic American, and Native American populations. COVID-19 is not racist, but the structural social racism creates conditions that put women who belong to minorities at greater risk. Psychologists, activists, and police agree that compulsory confinement causes more stress for couples and that complaints of gender-based violence have multiplied in various sectors of cities, including rural and urban areas. This reality is overwhelming and troubling. Structural inequalities, the imbalance of powers, and certain social norms cause women, girls, and adolescents to face additional risks compared to the rest of the population. It is essential that governments focus their response to this crisis by prioritizing support for women, implementing measures that have proven to be effective, and integrating prevention efforts and services to respond effectively to gender-based violence. Woman, if you are being a victim of gender-based violence, remember that you are not alone. Raise your voice. Do not be afraid. There are support networks where you can seek help, and it is important that you know what your rights are. Only this way, together, we can face the pandemic of gender-based violence.